PET-CT has been on our radar in diagnostic imaging in Edmonton for a very long time, for at least 10 years, hoping to try and get something at the Royal Alex site. About 5 years ago, we decided to go to the foundation and see if the foundation would help us to get there.
The campaign raised $3.5 million for this vital piece of equipment that essentially allows diagnosis of disease at the molecular level.
PET-CT is unique. It's completely different from what we do pretty much anywhere else in medicine, but certainly in radiology. Generally, we're looking at anatomy. With PET-CT, we're looking at biology. We're looking how does a cell function? And abnormal cells function differently than normal cells. And they pick up these different kinds of radio tracers and they do different things with them. So we can uniquely target and look at certain kinds of cancers, certain brain function, cardiac function, all these different functions that we wouldn't be able to look at in a variety of other ways. When we're treating you, the patient, and you have this function that's not working, we can tell whether the specific therapy you're getting is that therapy working, and we can see improvement. And if we don't see improvement, well, then we need to try a different therapy. And so not only can we diagnose, but we can monitor treatment. And that brings us back to that individual personalized medicine that we're all trying to get to, because one medicine may be very good for one disease for one person, but maybe not so good for the next person.
Well, the Royal Alex is a powerhouse provider of care, both in inpatient and outpatient care, and certainly in trauma and the diagnosis of disease. So the PET-CT scanner really crystallizes the fact that we needed to have this equipment to help every area of care at the hospital. And we see patients from throughout Alberta and of course Western Canada. In fact, a third of Canada's landmass. This is a strong referral site and an area of patient care.
I got a call from the ENT specialist. He said that, he told me that I had stage 4 carcinoma, sinus cancer. They said that the doctor wanted a PET scan because they needed to determine where the cancer was and how he was going to treat it. I was concerned at that time about how long that was going to be, because I was supposed to be getting them every 6 months for the next 3 years, and then one year after that. And within a week of him telling me that he was going to get an appointment, I had my papers in the mail with an appointment for the PET scan.
As a former patient myself, I was diagnosed with cancer and had a surgery in 2019. I can share that there's a lot of anxiety that comes with a diagnosis like that. So anytime that we can improve how we do things, we want to do that. And it's donors often that play the biggest role in allowing this technology to take place. So we can't say thank you enough.
It helps all sorts of things for this hospital. It gives it another identity. And your donation, big or small, your donation has made a difference, and it's made a big difference for us. And thank you. Thank you so much.
I have some words that I'd like to share with the donors. Words cannot describe how thankful my family and I are. When faced with such a life-altering diagnosis, there are a lot of emotions and questions that run through your head. Having the opportunity to receive answers to those questions through the PET scan gave us hope, and for me, a chance at life. We are so lucky and very thankful. Thank you from my heart.